Hey everybody, Dr. Daniel Klauer here with the AACP. I just wanted to shoot a quick video to introduce you to Dr. Wang, joining us from the University of Maryland. Dr. Wang is going to be presenting our annual conference. So I'll start off with Dr. Wang. Welcome. Thank you for agreeing to come out and join us in Indiana. Just to start off, why don't you tell us a little bit about your training, education background, and some of your research topics over the years, and then we'll dive into your presentation more.
Thank you, Daniel. Hello, everyone. My name is Yang. I'm a pain psychologist working at University of Maryland School of Nursing. My background is pain psychology. I have been working with chronic pain patients, especially people with temporomandibular disorders, for the past few years. And my research interest relies on the placebo effects, which we see improvements in pain symptoms, which is triggered by inert ingredients. And I'm interested in looking at how psychological predictors for placebo responders and non-responders. And recently, we have more research going on with virtual reality and chronic pain, where we found initial findings from our lab where virtual reality has this capacity of reducing chronic pain via the trigger of endogenous opioid system. And today I'm very happy to share more advanced and more recent findings from our lab with you. Thank you.
And what would you say is one of the most profound things you've learned about like TMD patients dealing, whether it be more on the virtual reality side, placebo side? If you look back in your years of research, like what's one little nugget of that kind of surprised me, or we're confident we know that now, that you'll be sharing with us?
One thing, because I see patients actually almost every day, I screen them, I talk to them. One thing I realize is how diverse this population is. So although we still know so little about them. So there are like different sex, different age, different races, and different psychological and socioeconomic background. And to our surprise, every aspect actually contributes to their pain. And from a temporal domain, early childhood trauma, and also what happened even yesterday will influences the pain today. So this is really a very complicated phenomenon, because pain, first of all, is a multifaceted phenomenon. But at the same time, a lot of factors influences pain is also multifaceted. So what we really want to know is to build a model that we can predict using all the aspects from biopsychological and social factors to provide more precise medicine for people experiencing different background. And also the classification of TMD is also important, because if we look into clinical phenotype of TMD, some people, they have orificial pain, but the majority of them, they have not only TMD, they have additional other chronic pain conditions like headache, lower back pain, knee pain, osteoarthritis. So those factors definitely will contribute to the choice of chronic pain treatments. And we are actually offer a very novel non-pharmacological intervention that is promising for us to target on different aspects of pain, not only on sensory inputs, but also on mood regulation and on relaxation. So it's actually trigger biological change, where we hope we'll be able to somehow boost the endogenous internal healing process.
Yeah, that's so cool. And what's great is with your PhD background and clinically seeing patients, that's so valuable. And love to pick your brain more in the future about that adverse childhood experiences, because definitely see that. And that's something that's hard as us dentists and or physicians who are treating a physical problem. It's sometimes difficult to go into that realm because we don't have the training and expertise, but just finding a comfortable way for us to introduce it, at least to get them to the right person to then go down into that realm of discussing those traumas, because I've definitely seen it in our patients, and I love that that's kind of coming up in your research, and you'll be sharing that with us. So we're really excited to have you. Thank you so much for taking the time to join us and share your knowledge and expertise. Look forward to introducing you to a lot of the dentists and physicians there, and we'll see you in about a month.
Thank you so much, Daniel. So I really feel honored to. Thank you so much for having me.